The first person I'm going to introduce is Robin Brown. She is the mother of two daughters, a grandmother of three. She's an environmental injustice advocate and organizer with a focus on lead poisoning of African American children. She's been doing this for over 2 decades. Robin is a certified lead risk assessor and lead lead contactor. She has received numerous community recognition awards for the work she does for our children and for people everywhere. She's very active, serving various roles in the following communities: the Cleveland Christian Development Association, she's a founding member; the newly formed Cleveland Environmental Advisory Coalition; St. Luke Foundation Resident Advancement Committee; and the Cleveland Participatory Budget Committee; Ohio Lead Free Kids Coalition; Lead Safe Cleveland Steering Committee; Black Environmental Leaders; Poor People Campaign Regional Chair Coordinator for Environmental Justice Committee; and Kinship Care Committee. Robin also serves as a CAB member at Care Alliance Healthcare Center. Robin comes to us tonight from Cleveland. Please welcome Robin Brown.
Good evening, everybody. Thank you for allowing me to be here. I will be speaking today on being misled by lead, which is our topic. CCO, Concerned Citizens Organized Against Lead, was created in 2005 by myself and my family after my daughter was poisoned in 1999 with a lead level of 70 micrograms per deciliter. The reading today for a child is now recently set at 3.5. 2017, the CDC, which is Center of Disease Control, set the level at 5 micrograms to be concerned. Just in the last 3 months, they lowered it down to 3.5. So that's the most aggressive I ever seen those numbers drop. Our concern came for CCO, which is our mission statement, is to educate, empower, collaborate, and to eliminate childhood lead poisoning within families and communities. As you heard Bob open up, in 1956, his lead lines were being replaced by his dad. So 1956 and beyond, this issue has been around, been hurting and contaminating people. And we are just getting to the place in our society of working very effortless to work and combat lead poisoning. So I'm glad to be part of that. The problem again started with me when my child became lead poisoning at the age of 4 with 70 micrograms per deciliter. Also in the hospital in 2005, when her doctor asked us to immediately take her to the hospital, don't stop, she's going for direct admit, and recognizing that redlining exists. That was the hardest thing for me to realize, that we are still having, inequality in spaces that should be equal. My private pay insured doctor, that is our family doctor, never showed up to the hospital of her 5-day stay. We were given an assigned doctor from the hospital that had no relationship to her or I, and no reason why her physician never showed up. And we did not get information on lead poisoning itself as they're treating my daughter. No one came and sat and told me exactly what I'm going through and what I'm dealing with, or what I'm going to be involved with for the rest of her life. The social worker came on the 4th day and told me about her discharge plan, which include an inspection to secure the hospital not sending her home to a place that could contaminate her again. And during that inspection that evening on the 4th day is the first time I ever knew what lead poisoning truly was And that came from asking the inspector questions on what are you doing and why is lead so dangerous. I lost it when I did find out. Can you imagine your daughter being, or your child being treated for 4 days already and not really knowing, but trying to do the best as a parent to secure their healthy, and along the way, I could have been doing more damage, not knowing, because I didn't know chelation, which is the therapy they did. There's no treatment for lead, but chelation therapy is a method of pulling lead poisoning from a child's body when it's at a high level. They don't start that process typically until the age of 35. And again, not knowing about lead and what could be done to manage was horrifying. When I did, it came from another parent. And to this day, if I did not meet that parent and left it up to the healthcare and the right resources of administrational health departments, my daughter would not be the child she is today. And you will get to hear who and what she is today, but she wouldn't be that child. And so realizing about redlining, which was intentionally created to disappropriate people of color in certain neighborhoods, and it still stand. It was affected for education, wealth, and health. And today we're still dealing with that today. The objective today is recognizing that advocacy comes in different forms and level, getting the voice of the people affected by lead, by the issues at the decision-making table before any plans are drafted. What we're finding, they may come talk to us, but you already have your plans and we can't help with the solution. Most solutions come from the people who are bearing the issue. They already think about solutions, and that's what we did. Our advocacy model was 23 years ago. We started by identifying the problem in the hospital. We, as a family at 70 micrograms per deciliter of lead, which is equivalent to death, seizure, and coma, if we did not receive the proper treatment, our concern became, what about everybody else less than us? What about the families who don't have a 70? And if we're getting this, what are they getting? And so my daughter at the age of 10 said, Mom, please don't let my poison be in vain. And anytime your child asks you to do something like that, you're going to make it happen. And so our family created CECO, Concerned Citizens Organized Against Lead. We went out and did surveys. So we identified what is the problem with families, what is families missing, and what do they wish they had to conquer this problem. And we found lack of education. So many people have not heard about lead poisoning or knew it existed, did not know we're 3 times as bad as Flint in Cleveland, Ohio. And if the water didn't happen in Flint, we may not be talking about lead in Cleveland today. So what we did was identify the problems. We did a survey with 50 parents from children that are 40 down to infancy, and did a survey on what they wish they had in education. And it fell under what is lead, where is lead, how do you manage it, what can you do, how do you prevent it, and what are the laws for tenants and residents. So we created a curriculum that was a 4-hour curriculum, and we narrowed it down to a 2-hour presentation for education. And the whole model was to bring people who are afflicted in the space to work in the space, teach them how to help themselves. Because we know we can't always rely on resources, we have to know ourselves. So that is what we did. And the action steps that we took was reaching out to the community, getting them educating, starting with 20 educators in the city of Cleveland. We end up over Greater Cleveland and now we're beyond. But it was workforce development in a whole different level of infrastructure. We focused on the human infrastructure, which most people ignore. It's almost as if the human um, individuals who have been poisoned don't exist, I guess, out of sight, out of mind. And that makes us not have to deal with it, but we're here. And if we are here, let us help with the solution bringing to the problem and help ourselves along the way. So we were able to start with education, but from education, we end up doing citywide lead screenings. We took up education into childcare providers where we were partnered with Starting Point and CEOGGC type daycare centers. So our advocacy took a little different turn initially, where we started boots on the ground and grassroots effort. And we were able today have reached over 178,000 people through education, presentations, media, news, any way that we could share the word, we're doing that. You know, today we kind of talking about advocacy a little bit more and being misled by lead. Man, biggest myth of lead, you have to eat the paint chip. That's true, but it's not the only way. And children actually get poisoned more by the lead dust than the actual eating of the paint chip. Now, the lead dust becomes very mysterious because you can't see it by the naked eye. It's not the dust we see on our landings, on our surfaces. We can't see that at all. But if we're raising up and down our windows and we have old wood windows with paint, we could be causing that dust to get onto our surface. And when our kids put their hands or even tap the screen, they're going to breathe it in. When our kids run down the halls and we might have cracks or chipping paint and we're going down stairwells, because I know my daughter was a good example of running down the stairs and taking that hand, and you will not see it on the bare hand, but they could breathe it in. So lead dust from demolitions is very important to know when demolitions are taking place for many reasons. One, you can secure your home by doors and windows being closed and try to like cover your air ducts of your air condition so that won't come in. But also you can clean your porches and hose them off because that dust is going to travel 500 feet from wherever a demolition has been done. If they do not use the connected water hose to the actual fire hydrant, that's a must. If you see a demolition being done on buildings, homes, and that hose is not connected to the fire hydrant, you have every right to stop that demolition. You have every right to talk to the manager, supervisor on site, find out who they are, their company name, their license on their trucks or anything. Find that out, but you also say to them, you are not using the water hose. If you do not connect the water hose to the fire hydrant, you have to cease the demolition. And we will ensure, we didn't give out the building and housing number per se for Cleveland because every area have their own, but you would call your building and housing department, let them know a demolition is going on, it's being done incorrectly. Here is the information for these people. Let them know you're talking to them, put it on speakerphone, take pictures, videotape, because they are liable when found. And they have to pay a fine for those incorrect demolitions, and it can mount up from 5,000 and more. So we don't want it done wrong because it hurts people. And I have seen many women, even pregnant, standing in the mist on the main street and a building or something is being demoed. Actually, on Broadway, I stopped my car. It was so bad. Me talking, I had gravel in my mouth from the dust buildup. And that poor lady was standing across the street from that poof with her 2 children, along with being pregnant. Pregnant moms can pass lead dust to the fetus if they breathe it in. If they're doing demolition and remodeling in their home, if they don't do it correctly, if it's not being done correctly. As an adult, we get lead in our system, but we can usually pass it through. Um, and it doesn't affect us unless we work around lead. So families affected with lead comes in all kind of pictures. It's not just the child that was poisoned, it's the whole family. It hurts everybody. My 14-year-old daughter, because she was 14 at the time her sister got poisoned, I figured she could go stay with grandma. She knows the circumstance, she's okay. She wasn't okay because she seen her mom hurting, her sister, now diseased and poisoned, and she see her damages each and every day. She say to me, Mom, her lead must be kicking up, acting up. So again, it doesn't hurt just that child. Peer-to-peer program is what we did to match families with a elder family, with a new family, because as you heard me say, another parent is what carried my daughter to the success of who she is at 27 today. And the minimizing of lead really came from her working with me. I can take those phone calls in the middle of the night when that guilt is hitting me, hurting me, when I'm feeling bad that I was a bad parent because my daughter is now poisoned. Then when I get angry to realize it's not me, but this was intentionally not corrected and society poisoned my daughter. That made it even worse because I did everything as a mom to bring a healthy child to this earth, to be brilliant, bright, and healthy. And it got destroyed by environmental issues that is preventable. And under the environmental justice space, you heard Bob introduce on some of my spaces where I work at and working with the public health. Some of our advocacy work has been working with the Lead Safe Cleveland Coalition, bringing the lead safe certification ordinance law into fruition. I speak and present any place I can because the message of lead and what it does to the human body is so important. The infrastructure of homes and pipes are, but we have people who are living their whole lives with this lead poisoning. And the scary part is we probably have more misdiagnosed and undiagnosed individuals than the known individuals. And that becomes even more scary because they can't manage it if you don't know. And so when we talk about the US, I actually just had an article speaking on the USA, half of the population is poisoned. So again, we're talking about unknown numbers and lack of testing, which is so horrendous now because of COVID. But before COVID, it was devastating. Now, lead screening of children is so plummeted, and that's the only way to know a child have lead poisoning is by a lead poison test. The only way. You can't go by symptoms because the symptoms mimic so many other things, right? So we have like ADD, attention deficit disorder, and we have attention deficit hyperactive disorder as symptoms. We have a lot of kids in our school system with both of those things. And for me, I tied it in a long time ago that lead, children, ADD, ADHD, we have to be proactive to pay attention to these symptoms and can't ignore the people because it exists. And we may have curbed this lead thing a long time ago if we tied it into the ADD, ADHD school educational space like they're doing now. So with the environmental justice, we don't want to play with lead. We're working with I'm sorry, I got kicked over and I'm trying to find myself, sorry. With the biomimicry and remediation, we're actually working with Chris Moore from Red House, and he works with fungi. And it's really great because he takes old demo material out of the home. So your walls, your slats, and things of that kind of hold lead. Instead of going to the landfills, we're taking it and going under a biocycling process where the old material goes in and blind with the mushroom and the new process, and it turns green and sustainable. But it's also encapsulating the lead that would be going to the landfills. So it's no longer in the landfills, it's no longer leaking into our water because it's not being exposed anymore. We are in our 4th year planning. It is actively being used. If you want to know more about that process, look up Red House Studio, and it's located on West 117th. But that is our way of starting to look at green, healthy housing, not just for the removal of lead from the environment, but it also help mold not grow in between the walls because of the fungi. So that would help with respiratory too. So we're not playing with getting rid of lead. We're working on eradicating lead like it should have been a long time ago. And how can you help families at local and state levels? Parents should be able to request a risk assessment between the age of 3.5, between 3.5 and 9 micrograms per deciliter. Right now, they don't give the risk assessment for that level because it's a concern level and not the diagnosed level. Any level of lead that a child has in its body can do damage. So therefore, it should not be a limit on when activities start to the families by a given number. Poison is poison. And even though my daughter was at 70, a child with the 3.5 can have more damage than my daughter outcome because of not having proper nutrition and managing it. So another thing is continuously requesting funds for outreach to families. They're doing infrastructure money, and we're trying to bring that infrastructure from housing and pipes over to the human side because our kids live with this. And as they're aging, my daughter is 27. She has issues still. If she didn't have medical insurance, how would she be cared for? Right? My daughter is blessed, but there are people really dealing with serious mental illnesses. We're having people that are diabetes. It hurts the heart and coronary spaces. So it causes cancer. So it's places that we never seen. And I want to thank you guys for allowing me to share. Again, it's a lot of the subject and it's kind of putting it together. But if you ever want any more information, please reach out to me. Thank you.
Thank you so much for that presentation. I was really impressed with how aware you are of what the hazards are, and I think spending time with you, I would learn a lot more about that. So I think we should really reach out to you when we see an issue like this. The reason that SPAN Ohio brought this program on was because of the recent establishment of a health equity committee in SPAN Ohio, because we became aware of how people of color and people in places of poverty, often those two go together, have with healthcare issues and those issues not being attended to. So this is why we planned this program. And it certainly has shown to be very true about what you have experienced. So thank you very much. Diana King, who is our next speaker, is a mother of 3 grown sons. She is an environmental injustice advocate and organizer. She is focused on underrepresented populations for over 15 years. She has participated in Concerned Citizens Organized Against Lead as an administrative assistant to the executive director. Diana is on the steering committee for Lead Safe Cleveland Coalition, a parent representative for Ohio Lead-Free Kids Coalition. And she is the newly appointed public representative of Ohio Lead Advisory Committee on the Cleveland Environmental Justice Committee. Northern Ohioan for Budget Legislative Equality and co-chair, which has a focus of having inclusion of underrepresented populations in Ohio in the state budgetary process. Diana is Northeast Ohio's Poor People Campaign and local member of the National Poor People Campaign, a rally in DC on June 18th. And she is the assistant to the regional chair coordinator for environmental justice. Would you please welcome Diana King?
I'm Diana King. I've been involved with various community groups that deal with poverty, governmental policies, and lead for the over 18 years now. I became involved because my sons were lead contaminated in a previous home that we were in. And I asked around, I even asked at the doctor's office for information, and all I received is a pamphlet. Here, this is about lead. That was it. Then I met I had a friend who had been to a meeting with SECO and told me, come to this meeting, you'll learn a lot. And if I had not met SECO and Ms. Brown at that time, I wouldn't be the person that I am today. I learned how to fight for myself and for my children through learning about lead and what it does. What was different about SECO is it was being taught from a community level. It wasn't being taught by nurses, doctors, administrators. It was just being taught by a community member. And they gave you everything that they went over. And she wasn't afraid to, if you have an upcoming appointment, and if you didn't understand what was going on and you just found out your child was lead poisoned, she'd go with you to these appointments so that you'd have a better understanding of what was going on with your child and how that would affect your family as a whole. And sorry, all, I am experiencing COVID-19, so it's affecting my voice.
Oh my, oh, wow.
I really want to put forward that lead poisoning at any level is detrimental to the child and to the family. And if you look at it, to the community at large. If we don't take care of it at the low numbers and deal with it there's going to be long-term cost on the other end as adults through either incarceration or various other health-related issues. And I would suggest that you go to Ohio Lead-Free Kids Coalition, the Cleveland Let's Say Cleveland Coalition, and get other information you may need about lead. And I'll turn it back to Bob.
Thank you very much. I'm sorry to hear that you have COVID. I have had a number of people close to me who have recently become infected, so we're not out of the woods yet with that. I appreciate your issue with having had this happen to you personally with lead poisoning in your family as well. And our final presentation is, and we will have questions after he is finished for all of our panelists. Our final presenter is Dr. Matt Nordsey Jones, who is the newly elected SPAN Ohio director. Since the spelling of his last name and his last name is unusual and unable to be pronounced correctly, we've come to call him Dr. Matt or Dr. NJ, and you're sure welcome to do the same. Dr. NJ is a longtime family physician in a community health center in Dayton, Ohio. He is there serving people who are on Medicaid or are often without any health insurance. So he is familiar with people who deal with lead issues relating to systemic poverty, including lead poisoning. Please welcome Dr. NJ.
Thank you so much, Bob. So yeah, I'm gonna keep my part pretty short because I've just been so amazed at the other speakers. Thank you guys so much, and your movement and your work that you put into this is so inspiring. But as Bob mentioned, I'm NJ. I'm a primary care doc here in Dayton, and so just wanted to hit a little bit on a few things on lead. Much of, like I said, has already actually been said, so I don't need to go through all of it. But I do want to reiterate that it's been said over and over that there is no safe level of lead. This is not something that, even if you're below 3.5, there is plenty of data to say that anything is a bad level for lead. It has lots and lots of side effects. Most of the ones, or lots of health effects. Most of the ones that we hear about are, those ones that affect the central nervous system. But it's certainly not limited to that. And what we've mostly been talking about, although with Ms. Brown's kiddo, obviously that was some acute toxicity on top of probably chronic lead poisoning. But what we usually think of as lead poisoning in children in the United States, at least, is more chronic lead exposure. There is acute toxicity, obviously, and it's the thing that in the US is mostly limited to occupational lead exposure. And that is something that happens to many more adults, actually. But it's not something to forget about in the rest of the world either, because especially in like Southeast Asia, it's a huge problem for where batteries that we use in cars have lead in them and are recycled-ish. And people are having no idea that they're being exposed to massive amounts of lead when they're doing these. So this is something that is not just a problem here in the States, but is a problem all over the world. And we, of course, in the United States, we haven't had lead in our fuel for many decades. But it wasn't actually until just last year that lead fuel was no longer sold anywhere in the world. And so far, only 40% of the countries in the world have actually gotten rid of lead paint in houses. And so that is something that, of course, in the United States, 1978 was when we outlawed lead paint for residential uses. But houses all the way up until then, and many of us live in houses still that have tons of lead paint. Mine was built in 1900, so I'm certain we have problems. But really, this isn't something new. It's something we hear about more now, but lead poisoning was first reported in the late 1800s in Australia. We've known that childhood lead poisoning has existed for a long time. Some of you may have heard the stories about how much fighting there had to go into in the 60s and 70s to try to get people to actually take seriously the fact that lead poisoning was doing horrible damage to our children. But in children, really, no organ system is immune to the effects of lead poisoning. Obviously, the developing brain is the one we worry about the most and has some of the longest lasting effects. And the reason it is such a big deal at the ages that it is because this is when children's brains are growing and developing so much. And so we see these significant insults right when they're supposed to be developing and growing, and it causes long-lasting damage. The way that the lead this is probably more than people need to know, but the way that it causes problems is actually causing what are called reactive oxygenated species that you've probably heard of antioxidants. They interfere with the work of antioxidants, and which causes damage to the tissues. And that is why it goes to so many parts of the body and causes damages everywhere. So it gets into the intravascular space after kids or adults eat it or inhale it, and it quickly binds to red blood cells and travels all over your body. And that actually gets out of the body, out of the blood in about 30 days, but it goes into the kidneys, the brain, the liver, and the bone marrow. And in the bone marrow, it can have a half-life of several decades, actually. So it stays in your bones for a long, long, long time and can cause problems later on. Those brain issues that we see, can cause obviously delayed or even reverse development. It can cause learning disabilities, seizures, coma, and even death. And, one of the reasons why we start worrying about lead so the recommendations for testing for lead is to start at 1 year old, at 12 months, to 24 months, and then again later on if they didn't get tested earlier. But the reason why those are the ages that we worry about is because that's when kids are tending to put a lot of things in their mouth. But as Ms. Brown said, this is not something that's just like kids going around and eating lead paint either. We've all found out having to wear masks how often we put our hands on our faces, right? And so this is the same thing. It's even worse in kids. This is also a time when they have actually higher levels of gastrointestinal absorption, so they're able to pull that lead out much more efficiently than us old fogies are. But the incidence, is we've already talked about, is a huge socioeconomic problem. This is so much harder on communities that are already having a hard time, and that's for a lot of different reasons. It's kind of this is where all of those roads meet on the intersectionality of being poor, being minority in this country right now, because we tend to have older houses that haven't had anything done to fix the lead problems that we already have, as we've seen in places like Flint. And thank you, Ms. Brown, for pointing out that so many of our other cities too have this problem. We just don't talk about it because we figure if we don't know about it, it's not going to happen, right? And you have a population that doesn't know about it, and so doesn't know to advocate for it, as so wonderfully these ladies are doing. It also actually, so lead gets absorbed better in people with worse diets too. So our problem of the huge disparities in terms of food deserts also makes this worse. So people with higher fat diets, with lower vitamin C levels, all of these things makes lead get absorbed better, actually, which is really why it becomes such a big problem in poor and minority communities. People already mentioned, I wanted to touch quick on symptoms-wise. There is only one way to know if you have lead poisoning, and that's blood testing, because the symptoms they could be nothing, and they could be a lot of things that a 2-year-old does all the time, right? Acting irritable or grouchy, like who knows if that's just my 2-year-old or if that's, something with lead poisoning, behavior problems, learning problems, headaches, weight loss, sleep problems, constipation. But really, the only way to know is to test. So like I said, children are at most risk from 6 months to 3 years. So the testing that the CDC recommends is starting at 12 months. But kids remain at risk up to 6 years old. We already mentioned was pregnant and lactating women are also at high risk, because this can pass to the fetus. It can also pass through breast milk. So breastfeeding women have to be very careful with lead levels as well. Anyone who's in a house where another member has found to have an elevated lead level should be tested, should be screened. We already mentioned anybody who lives in a house built before 1978 can have lead in their paint or in their soil or just in the dust. And obviously those who are living in more lower income communities, it's recommended that everyone on Medicaid get tested. And it really depends where you are as to how good that testing is, and it's really not good enough is the short answer. It's estimated that about 24 million homes in the US contain deteriorated lead-based paint and elevated levels of lead. Obviously, we don't know those numbers for sure, but that is a lot of children. They're at really high risk. And when it comes down to it, preventative care is the only way to stop chronic lead toxicity. Like, we have to be on the lookout. We can't wait until we see symptoms. So just to kind of finish up from our standpoint, why, obviously there's a lot of healthcare stuff here. Why single payer? Like, why does that matter to this fight? Or why does this fight matter to us? It's because we know that all true healthcare demands that we address all of the socioeconomic factors that cause our health disparities. It's over 500,000 children, we think, probably have under age 6 have levels of lead greater than 5, and that was, like Robin mentioned, the old cutoff. It's even higher if you drop it down to 3.5. We see that this is an intersection of where racism in healthcare and where poverty in healthcare intersects, and we know that there are other things like climate change induced health problems that are also at that same intersection. And finally, lack of insurance or bad insurance stops people from getting the care that they needed. And that's just like across the board, obviously, but it matters even more when we're talking about preventative care, because we know we need a system that has no copays, that has no deductibles, that doesn't cost you at the point of service, because it's the right thing to do, but also because it stops people from going to the doctor. Study after study has shown that there's no reason we have to do it. It's actually costing us more money to have a system that allows people to get sick and die, and not just, like get sick for a little bit, but get sick for the rest of their lives. And that's morally reprehensible. So that's my soapbox. I'll get down off of it now, but thank you guys so much for coming to this talk. And again, thank you for all the work you guys have been doing, Robin and Diana.
Thank you so much for sharing your work and the information you just did. I was listening to you, and it's so phenomenal. If we can have more physicians with straight up good attitudes about lead, we may be able to get more done. I have to say, even in our community, which is definitely an underserved community, kids aren't being proactively tested, knowing that's the only way. So I applaud you for the work you're doing and speaking this message, and whatever we got to do to share to other physicians to put that urgency in this space. Because most parents, if they go to a healthcare facility and that facility doesn't have that urgency, what makes the parent gain that urgency? So, keep up the good work.
Well, thank you. Yeah, I think that's a really good point, actually, because I think a lot of times, especially in the healthcare system that we have, doctors feel, rushed and pushed on other things, and then they don't. It's hard to talk, like to convince the parent, like, oh, you need to go do this test somewhere else, right? And there are testing available that can be done in offices, but many doctors' offices don't have that. And it would Bill just talked about lead tests being done by a pinprick rather than a venous draw, and yes, it can, Bill, and that is exactly how it should be done. Just because if we can take away that extra step where somebody has to go somewhere else to get something done, has to have the transportation to do that, has to have all the other things that are involved, this would allow more testing to get done and people not to fall through the cracks.
I so agree. I was like, won't they take the one step out of the finger prick? Because you have to get the confirmation. You got to get it drawn anyway, venously. So let's do it the first time. My granddaughter just went through the lab work. My daughter took her to the doctor. She doesn't get off of work till 5:30. By the time she finished the appointment, the lab was closed. So it's not always that they can't get back, but the convenience of the time of the lab, and that would so avoid all of that crap. I do have a question for you.
Okay.
I always said that due to people able to transfer lead from being poisoned as youth to their children, unborn children, as well as the other dust and other things that we as adults might be taking in and hurting our children by, why don't they test at birth?
That is a good question. I actually have to look more into the question. I think would the question that actually popped into my head earlier when I was listening and looking at this is, why don't we test more pregnant women, right?
And it's supposed to be.
Yeah, that's where the kiddo who is at birth would be getting those blood levels from, right? And so if we tested the pregnant women, we would in essence be testing at birth those babies that are born. And I'm not really sure why that's not part of that. And I'm going to have to look more into it and talk to some of my OBGYN friends, because I'm not sure why that wouldn't be. It's such an easy screen. And why would you not do it for everybody?
Why put 4 letters on the same requisition sheet that has to be initiated for a newborn baby? All you putting is the slot of lead, screening and check it off. You're drawing the blood anyway, right? So what would be so hard to put the slash mark with 4 letters behind it? And the reason I'm asking, we taught at a prenatal class out with Beachbrook. We do their prenatal classes. And one of the young ladies informed us about doing her remodeling of her nursery and everything. And she was just so, her emotions was showing on her face when we got through educating about the dust. And so she said, what can I do? I said, I would recommend asking for a screening of your newborn, because you can jumpstart management treatment early if you know it, opposed to waiting a year. And she did do it, and the director called me back and said that it was positive. So that was one individual that I know for a fact did do the screening, and due to her renovation, she was at high risk, and it came out to be so. So I think, one, also working with, and I push more with the physicians, and I talked to mines to say, to change where all Medicaid kids, it should be all kids. It shouldn't matter if you're on Medicaid or not, because I had private insurance, but I still lived in a neighborhood that was considered underserved. So I was still suffering with the insurance.
Yeah, and I come at this from a little weird angle from the physician side of things, because like Bob mentioned, I work in a federally qualified health center. So we see anyone who comes in, and I actually, it's been so long since I had looked at the specifics on what the recommendations are for lead testing. We do lead testing on all of our kids. Like, it doesn't matter who it is, but we also have a significantly more high risk population. And then that made me think about whether when my kids were young, did they test them because I asked them to test them, which I did, or did they test them because they test everybody at their pediatrician's office? And I don't know the answer to that. So
based off of my history of these 2 decades, one, we know testing is lacking. We also know that it's a federal law that all Medicaid kids be tested, and we're slipping on that. So we can know 9 out of 10 is not happening. And honestly, it's kind of sad. I was at a meeting with the Lead Safe Coalition, and it was a physician there, and he said, maybe if you guys incentivize us, we'll do it. And of course, that was the wrong thing for me to hear. But anyway, it was stated that way, and it's like, really?
That's horrible.
So again, if the importance isn't being done in the physician medical space, the urgency is not going to transfer over to the parents. The parents I spoke to, they say, well, we're hearing things from you that our doctors never even told us. And my daughter is now 8 years old, and I did nothing. I didn't treat. I did not try to manage. I didn't try to get it out to her system, because based off of the, services and things I'm receiving from the spaces, I thought it'd just go away.
Yeah.
So for 5 years, this child has, and her level is still high, but for 5 years, nothing was done to prevent it. And these are the stories that I encounter. And that's why it's important that human infrastructure space get heard. And you know it, you're experiencing it, you're working with them. So
one of the good things about the federal healthcare centers that like Matt works in is that they do see everybody, and they do do the kinds of investigative testing that other places will not do or won't bother to do. So I think it's really, I take my hat off to Matt, to other people who work in those community health centers, because they are on the ground floor of all of this. I suppose we're going to start the question and answer, and I'm just going to start off with a quick question. Is since this is happening in the state of Ohio, has there been, or is there now, legislation pending in the Ohio legislature to address more about lead poisoning, or are they just deferring to the federal government?
Can you repeat that? I'm sorry.
Is there any legislation in the Ohio State House or has there been legislation in Ohio about lead poisoning? Or is the state of Ohio just punting this issue to the federal government?
Working with the Ohio Lead-Free Kids Coalition, we advocate for policy and legislative change in that organization. So yes, it is being set up. They did have a lead coalition at the state level, which has not been meeting since COVID, and we're not sure if they're going to continue. There is changes in legislation policy. This is the first activity, honestly, in 23 years that I've seen from our local level, the city of Cleveland, as bad as we are, 3 times as bad as Flint. It's the first time we got a budget line for lead poisoning to remain, so that's positive. It's the first time that the state gave as much money towards lead poisoning ever, as well as the federal government putting money in as they're doing. So this is the first time that it's going gun ho. It's beautiful, but the only thing, everything is going to take time as it's being worked on, and our kids are still being poisoned. So we have to get that proactive intervention prevention space still.
I had a couple questions or comments. Lead poisoning, there's a lot of housing in the outer ring suburbs in Cleveland that were built before 1978. So Cleveland Heights, Shaker Heights, all those suburbs, Lakewood. And so they're all at risk too. And I know my kids were tested. So you're supposed to test kids, so I hope that people are getting tested. But one comment I just wanted to make is public health. So if we really were worried, we should be really going out in the community and doing testing, because not everybody takes their kid to a doctor, or if they do take their kids to the doctors regularly, like you said, there might not be a lab. The lab might have closed. So maybe what they ought to do is have public health and community testing, where you can, go to the rec center or the grocery store and just sit there with a lead testing kits. So that's one comment I wanted to make. But the other question I had was, I just looked it up, and I know Cleveland had a big, got some money. And I just read that as of March 2023, all rental property is supposed to be inspected. And you can't rent a place unless you're certified that it's lead free. So what's going on with that? And is it really going to happen, or are they going to put it off like they always do?
Well, right now it is moving, working with the Lead Safe Coalition and being the kind of spearhead of the certification program. Everybody's looking to Cleveland. We are entering into our 4th year. We had a slow rollout. It did not take place as we thought. Some of the negative parts was interacting with the various departments to make sure everybody was on the same page and one was not ahead of the other so that it could roll out together. So those things have been taken care of, but as with anything, there's always kinks in it. And for the most part, they got the money to do the spending, but it started off slow to me, in my opinion. But it's getting there. The big news of that space right now is the housing court for Cleveland took a landlord to court to see about that lead safe certification space. So that will be setting some precedent once it come out of court, and we'll see what happens.
We're going to take questions now that have been posted in the chat. Bill Davis and Connie Hammond will alternate reading them to our panel. After those are finished, we'll take questions from the floor, time permitting, from people who raise their hands. You can raise your hand in the section down below, or raise your hand so we can see it on screen. Bill?
Okay, I found a question. I'm not sure if this is the first question that wasn't answered in the whole list, but I was wondering if we know of any electronic noses that can be used to detect lead in the air.
They can test it like when they do the demolitions. I would call the air quality control department and ask them to come test. A lot of times it can be tested, but do they come test? No, because it's out of their zoning space. And if they get any false readings, well, not false readings, but bad readings, it's going to affect their dollar at the end of the day. I don't know if there's any individual probes that people could buy and just test, but I have called the air quality department.
Okay, now there's another question. How do you get the lead paint out of houses? And how do you prevent exposure when they're removing the lead?
First and foremost, contact a licensed contractor. You could do that by looking at the Ohio Department of Health. They have certified licensed contractors. Secondly, if you're physically able, or if your handy person is physically able to do the work, get them trained as a licensed contractor. It'll save you money because they'll do it the lead safe way. Also, EPA has a renovate, repair, paint rule, which is really starting to be fined. Contractors found doing work without this could be found up to $35,000. So with that, you learn all of the safety nets about renovating your home. And if you can physically do it, we recommend for people to do that. If they could physically do it, you can't do no one else's home, but it will certify you for your own home. And that's EPA RRP certification. And then otherwise, we recommend that you get a licensed contractor to do the work.
Okay, Gail has a question in the chat. If the dwelling is mitigated and the lead paint contained, but the water pipes are still lead, is the family still at risk?
Anybody want to take that? Diane, Matthew?
Sure. I mean, the answer is yes. I mean, the risk is different, right? Depending on where they're getting the lead from, and testing should be done on the water as well to see lead levels in the water. But Robin, you would be better able to comment on what the availability of that kind of testing is, because I am not sure.
In reference to the water pipes, contact your local water department and they will be able to give you a testing kit to test your water. Also, I know Cleveland Water Department have a wonderful little space on their website about testing your own pipes to see if it's lead or copper, and it tells you the steps to how to do that safely. So the Cleveland Water Department website have a lot of great information in reference to even changing your inner filter system, which I don't know the term of what they call it, but it's there. So I always send a lot of people to them.
NJ, you have your hand raised. Did you have a comment or a question?
Yeah, I actually had sorry, I didn't want to jump because I know a lot of people had questions. I was going to ask Robin, in the program you mentioned for having all rental properties have to be tested, is that a Cleveland area program then?
Right now is in Cleveland, but it is starting to branch off to some of our surrounding suburbs. Okay. People are picking it up. Toledo tried to do it at one point. The difference of Toledo's program and Cleveland program, which kind of piggybacked off of Toledo's, but we were realizing that the resources for the homeowners needed to be up front because the homeowner shouldn't be penalized really for this problem because they didn't know like nobody else knew. And ultimately, the people who made the paint should be, but that can't happen. So anyway, the best thing is to just go that first route.
Thank you.
There was a comment in here that the nursing school has been going into some of the schools, Cleveland Metropolitan Schools, and testing children. So that's a
Yeah.
good thing.
Case Western Reserve was doing it right before COVID, and that's when we found out that really half of our kindergartners are actually poisoned with lead from Case doing that study. And they didn't even get to all of the schools. I want to say they did about 20 of them, and that outcome came out. And then COVID came, so that, of course, stopped everything, but it was happening from Case Western Reserve. Dr. Lynn Lotus was actually working with that.
I
Deb
think
had
it's
posted
still
that-
going on. It's still going on. It's a cooperation with Case and the school nurse department in the Cleveland Metropolitan Schools.
Okay.
One of the things that Deb posted in the chat there was the talk from the Dr. Abdul El Sayed, who at our state conference a few weeks ago. And one of the things that was mentioned there was that one of the important parts of public health is that there's no wrong door, basically, for any of these sorts of services, and that we need to make sure that, you know, like somebody had mentioned, that you can get testing through, you know, through different programs at the state and local levels, but that we need to make sure, you know, I wonder about like WIC, you know, they do hemoglobins, they do anemia testing for kiddos. I don't know why they don't do lead testing, you know, and like there's lots of other places where people meet these programs that don't necessarily do everything. And is there a way we can unify things more? I think that's a conversation that needs to be had too.
And that would be good. I know during the 2005, 2010 years, WIC was being funded to actually do that. And it did make a big difference because people are going to go to WIC if they don't go to their doctor appointment. And so they were that catch net space, and it did work. But yes, that's something that we probably should look into advocating about, because they are doing blood tests already.
I see another question that hasn't been addressed. Arlene was asking about the movement to put rents in escrow if lead problem was not addressed. Is this a current action in Ohio?
I'm not sure if it's a current law or rule, but I would say for anyone to initiate a conversation with their landlords about the issue, put it in writing. If it doesn't get resolved that way, yes, if you feel you got those problems, take it to escrow so that the renter is not being penalized along the way until it get done. I'm actually in that space, getting ready to take my rent because my landlord is slow moving to adhere to it.
So I just wanted to say that I think that idea of testing newborns is really great. I mean, I worked as a postpartum nurse, and we had every newborn was tested for, I think, 5 things at that point. PKU was one of the major ones. So it just seems like it could easily be added on, but I don't know. I wouldn't know the channel to get that to happen.
I would say contact your state legislator and see if there's anything like that in the state of Ohio legislation. Marlene has her hand up.
Yes, as far as landlords, isn't there money that has been designated so that they can get some financial assistance to make their properties lead safe? I thought that there was a sufficient amount of money available, and if that's the case, you know, they don't really have a reason not to make a place lead safe.
That is true. There is enough money, at least in the Cleveland area, for the lead safe certification. We raised more money than we expected, even sooner than we expected. What some of the problem is because of the poor housing condition. If you have a roofy leak, a roof that leaks, and your paint is messed up, they're not going to paint your house if the water are going to leak down and destroy it. So due to other issues that may make the process not work, not as much that the money is there, it's other negative spaces that is occurring with individuals that didn't have the money in the first place to keep their house up. Not saying they wasn't doable to own the home, but whatever reason for the maintenance spaces not being done, that can deter you from being able to get the loan or the grant. Say it that.
Okay, right. Thank you. I wasn't aware of that.
Yeah, there's also there's income guidelines on the grants. So if you make $2 more, you're not going to qualify for the grant. Are people hesitant for a loan at this climate of income space? You know, do I want to pick up another debt even though they have to? So it's all kind of things kind of weighing in there, but it's not as straightforward as people think. And then a lot of our homes are bought by investors, especially on the east side where they need to be. So getting in touch with those investors and getting them to sign documents and paperwork is also, you know, a hindrance as well.
Sorry. Any other questions from the group? That being the case, I will call this to an end. I'd recommend to you that if you'd like to receive information from Span Ohio about future programs, please go to the website and become a member of Span Ohio. There's information on that, or you can become an associate of Span Ohio, where you can get the emails and information about future events and be notified of those, and receive email from Span Ohio about issues that are pertinent in your neighborhood, in your community. We are all over Ohio, so that we can respond to your questions and needs wherever you are. With that, I will say thank you to Robin, thank you to Diana, and thank you to Matt for your presentation. I sure learned a lot, and I'm grateful that we have done this. We'll go on from here. If you have any questions for the Equity Committee of Span Ohio or comments, I put my email in the chat. You can check that out and send me whatever questions and comments you'd like. Thank you so very much. May the rest of your evening go well. We still have sunshine out, so go out and enjoy. Good night.
Good night. Thank you.
Thank you.